Good evening and welcome to IHW Council's special web series on women's health. Start supporting treatment in assisted reproductive therapy. I'm Anisha Nair Thapan and you're watching our exclusive web show on women's health supported by Bharat Serums and Vaccines under its public awareness initiative. With the second wave of the COVID pandemic nearly behind us and vaccination rapidly catching pace, restriction on movement has been eased by governments in most areas where the positivity rate is under control or less than 5%. This has allowed people to return to their offices, take vacations, and restart social mingling, of course, with COVID appropriate behavior. Because there is one thing this pandemic has taught us that we cannot put our guards down. We have to ensure masking, washing hands, and social distancing. This is also a reminder to put our health before anything else. The resumption of the normal lifestyle has given hope to many people who were in despair as some of their dreams had suffered a setback because of the many restrictions of the lockdown and the fear of COVID-19. I'm talking about couples who dream about starting a family but are unable to do so because of infertility. Infertility over the years has emerged as one of the most common health issues that many young couples are facing. According to the Indian Society of Assisted Reproduction, infertility currently affects about 10 to 14% of the Indian population, and the scenario is worse in urban areas where one out of every six couples is affected. Our show is special as we are going to discuss all aspects related to fertility and IVF treatment. Bharat Serum Vaccines Project START is an initiative that aims at providing support to couples beyond medicines with initiatives like microfinancing the treatment and counseling. Project START encourages couples to stay on course for IVF treatment to achieve their goal of parenthood. Today, we'll be talking about failed IVF, know what to do next. On our show, we have an expert joining us to help answer all your questions. Please welcome Dr. Deepak Goenka, Director, Institute of Human Reproduction, Guwahati. Welcome to the show, Dr. Goenka.
Good evening, Anisha. Thank you.
Dr. Goenka has extensive training in ultrasound, assisted reproductive technology, and genetics at different leading centers in the world. He has performed more than 20,000 IVF cycles and more than 3,500 laparoscopic surgeries. Before I begin the conversation, I would like to remind our viewers today to keep sending us your questions by typing them into the comment box and putting your question as and when it comes to your mind. Don't wait towards the end of the show because we will try to answer as many questions as we can over the next 30 minutes. Do like and comment with your feedback and share this with your friends on your wall or their wall if you think that they will benefit from this conversation. So let's get started, Dr. Goenka. Now, there's a lot of preparation for IVF and a lot of steps before you come to IVF. Now, sometimes it doesn't work. So what could be the reason why IVF cycles fail?
In the first, Anisha, let me thank you for the kind introduction. And I would like to thank the Bharat Serum also for this initiative. This is a very, very important initiative for the public information. Now, coming to your questions, why do we fail in IVF? Right? We must remember when we started IVF somewhere in 1970s, the first baby, Louis Brown. At that time, last week only, we celebrated Louis Brown's birthday. And at that time, the success rate of IVF was somewhere around 300 attempts and one success. So out of 300 attempts, we used to have one success. We must remember what's so special about IVF. Why IVF is so special and why IVF does not succeed. How many of us seen the human egg with our naked eye? Have you seen, Anisha, human egg with your naked eye? No, we have not seen that. So that's the beauty of IVF. God has made our body so sophisticated that human egg doesn't come out of the body. It stays within the body all throughout the fertilization, all throughout the pregnancy. And in IVF, we take out this egg and then we culture it in the laboratory and then put it back inside the uterus. So something very, very, we need to match nature, which is not easy task. Matching nature is always a challenge. And this is one of the reasons where one clinic outperformed the another clinic. So there are multiple reasons why our IVF cycles fail. There may be problem with the egg. There may be problem with the sperm. Basically, I personally always say there are three E's which are important for IVF success. Number one is embryo. Embryo means after the fertilization of the egg and the sperm. So embryo has to be very good. It has to be genetically good. Number one. Number two is endometrium. Endometrium is the place where the baby grows inside the uterus. So uterus has to be receptive. It has to be perfectly receptive for the embryo. That is the second E. And the third is the environment, our body, how we are, what type of environment we are giving to our embryos. So if we fail in providing any of these three, the success rate decreases, the IVF decreases. Today, with the advances in the modern science, success rate of IVF is somewhere around 50 to 60%, whereas natural conception rate in per attempt is around 10 to 15%. So we have improved 10 to means almost 5 to 6 times than the better than the nature. But still, I do agree we have a long way to go. If there is a problem in any of these three E's, we don't succeed.
So, Dr. Goenka, let's take the three E's one by one. Let's talk about the embryo. You said that nobody is seeing the egg outside, but through IVF, we culture the egg. So what you do is actually you culture the egg and the sperm together and you create life, like it happened in our body. Now, why would the embryos not be good? What would happen in the womb is happening in a petri dish. What could impact the embryo?
Very, very important thing to understand here. Embryo is a combination of the sperm and egg. The quality of the egg may not be very good. In the first, suppose as the age increases, the quality of the egg also decreases. We all understand this. Many times we think, okay, the age of the wife is suppose around 35, 36, 37. And with our ever-growing society, late marriages and late childbearing is also not very uncommon nowadays. So because of the late marriages and late childbearing, by the time they decide to go for the pregnancy, the age factor as a result, poor quality of the oocyte, that is a very, very important reason for the IVF failure. Second important reason, what about the sperm? Alcoholism, lifestyle management, how do we manage our lifestyle? That is another very, very important aspect which affects our sperm quality. Elderly, not only elderly female, even the elderly male partner also decreases the quality of the sperm. If we have a poor quality of sperm or poor quality of the oocyte or egg, obviously the embryo cannot be a good quality. So these are few of the important reasons. Obesity, again obesity, whether it is a male obesity or a female obesity, both obesity anywhere decreases the quality of the sperm or egg. So these are the few lifestyle things and the late childbearing which can affect the quality of the sperm as well as egg, and as a result the embryo may be poor quality.
Right, Dr. Goenka, then let's come to the second E, the endometrium. Why is it so important? Because in nature, once the egg is fertilized in the fallopian tubes, it comes to the uterus, it takes into the endometrium and fuses with the womb. How does this E, the second E, the endometrium, lead to failure of IVF?
We all have to understand this. A good seed requires a good soil to grow a good fruit. Am I right?
Yes.
Good seed is necessary, but as well as good soil is also equally important. Endometrium, in most of the cases, endometrium is usually not the culprit. We today, science has advanced quite a lot, and in most of the cases, we know that in more than 90% of the cases where the IVF is failed, endometrium is not the culprit. It is the first E or the chances of pregnancy. Tuberculosis, specifically in India, is creating a havoc. It is an important cause that our IVF fails. And nowadays, to overcome this problem, we particularly know that how much is the thickness of the endometrium should be there, how much vascularity in the endometrium should be there. In spite of everything, if the IVF fails, now we have another technology called ERA, endometrial receptivity array. That also we are doing in selected cases to find out if which is the right day, which is the right endometrium to transfer. So there are technologies which are coming up, and we are utilizing these technologies to overcome the problem of endometrium.
Could you tell us how do you overcome the problem of the endometrium? What is this error test, and how do you measure whether the endometrium is good for the seed coming in the embryo?
Okay. One of the basic tests to understand endometrium is ultrasound. Ultrasound is a very, very basic test to measure the quality of the endometrium. We look for the thickness of the endometrium, which should be 7 or 8 millimeter in thickness. The second parameter which tells us about the endometrium is how much blood vessels or how much blood circulation is there in the endometrium. That can be done by Doppler ultrasound. And now coming to the newer method that is called ERA, endometrial receptivity array. In this one, we don't only look for the thickness or vascularity, we directly look into the genes which are present in the endometrium, which helps us in implantation. So we require certain amount of the genes should be active, and there are certain genes which should be inactive. And if the genes which should be inactive, and if they are active, the implantation doesn't occur. So we have to have a knowledge about the genes which are active and genes which are inactive in endometrium. So this ERA test is a very simple test. In the previous cycle, it is like a mock cycle. It's a trial cycle we do in the previous cycle. And we take a small biopsy of the endometrium, and we examine all the genes which are important for the implantation into the laboratory. We get our report within 10-15 days. In the next cycle, we can identify which is the right day for transfer based on our previous cycle experience, and we transfer accordingly. So that increases our chances of pregnancy in some cases.
Dr. Goenka, we will discuss the third E, the environment, as well. But we started getting a lot of questions from our viewers, so let's start taking some of those questions as well. Now, Facebook user is asking, is pregnancy through first IVF cycle not possible? I think the question is it a given that the first attempt at IVF could be a fail?
Oh, please. This is a totally wrong notion. If you have not succeeded in the first cycle, this is unfortunate, but nothing like that. The people don't conceive in the first cycle. Almost 50% of the patients do conceive in the first cycle. The key for the success in the first cycle is thorough investigation. We should invest time and finances and resources in proper investigation. Don't jump for IVF directly. Go look for the investigation, look for the particular cause, and move accordingly. 50% or 60% of our patients do conceive in the first cycle.
Okay, that's a good ratio. Another question that is coming from a Facebook user is, what is the process of egg freezing? What is the right age? I mean, the age of the lady, I guess that is the question. That is there a particular age to freeze the eggs?
Okay, I will take this question into two different ways. Number one, I will put this question, what's the time for the right age for the egg freezing?
Yes.
Medically, I personally believe that every family should be completed by the age of 32. A family of a girl should complete by the age of 32. When I am saying complete family, I mean delivery of the two babies should be there, ideally, medically. In Indian female, we see that quality of the egg start decreasing by the age of 30, from the age of 32 onwards. So if the family is not complete by the age of 32, 32 is the right age. After 32, as soon as possible, one should start thinking about the egg freezing. Egg freezing can be done because of, for various reasons. Somebody is not yet married, pursuing higher studies or career. So on those female can think about the egg freezing. Lot of star casts and a lot of, you can say Google, Facebook, even in India, a lot of companies are paying for this egg freezing to their staff. where they are investing their prime time of their life for the company, and company is looking after for their eggs, for their reproductive health. So age is 32 is the right time. How is it done? Process is very simple and sophisticated. I know I am using a very contradictory statement words. Simple for the patients and sophisticated for the we clinicians as well as our embryology team. We give you medication. We must understand the process of IVF. Normally, every female develop only one egg per month. In the process of IVF, we require more than one egg, as many eggs as possible, which is good for us, good for the patient. It gives us multiple opportunities. So we give you the same hormones which are produced in your body in a limited amount. The same hormones are given to you in a slightly higher dosage so that we get more than one egg, maybe 5, maybe 10, ideal more than 10, around 10 is the ideal number. And we keep doing ultrasound. These medications are given in the form of injections for almost 9 to 10 days, you can say that. And time to time we do ultrasound, and we identify when your eggs are mature. On the day the eggs are mature, we give you little anesthesia, maybe for 10 minutes. During anesthesia, we take out all the eggs and we freeze it. That's it. Simple, isn't it?
How do you take out the eggs?
How do we take out the eggs? Okay, by ultrasound guide, we have a needle. First, we give anesthesia to the patient so that patient doesn't feel any pain. And by ultrasound guided, we put a needle inside the abdomen, in the ovary, and we create a negative suction in the needle, and we take out the egg.
So there's no surgery, there's no cutting, stitching?
No, nothing. It's a OPD procedure. It doesn't require even admission. It's a totally OPD procedure. Patient comes around 9 o'clock. Suppose I have fixed the timing of around 10 o'clock for taking out the egg. Patient comes around 9 o'clock, and at 10 o'clock we take out the egg. Takes around 10 to 15 minutes for the whole process. And by 1 o'clock, patient can go back. That's it.
Okay. Sounds quite straightforward. Now we have another question that is coming from a Facebook user. The question is, in IVF, what are the consequences of having low AMH levels?
Okay. First of all, we have to understand what is AMH. AMH stands for anti-Mullerian hormone, which is secreted from the growing egg. So basically, if we don't have sufficient number of eggs, AMH will be less. If the quality of the egg is not very good, AMH will be less. So AMH is an important indicator for us, which tells us about the quality as well as quantity. I'm so sorry for the background lights. There's a storm going on here. Because of that.
It's understandable. It's absolutely fine.
So AMH tells us about the quality and the quantity of the egg. So if the AMH is low, it is indirectly telling us that patient should be in a hurry. And if the AMH is very low, so say less than 1, then they should consider about the gamete donation also.
Right. Now we have a related question which is coming from Facebook user. My AMH is low, 0.22. Is there any scope to conceive with my eggs? If yes, what is the chance and what is the solution to this?
AMH 0.002 or 0.02 is definitely very less. Absolutely no question about the poor quality of the AMH here, poor amount of the AMH here, indicating that your eggs are almost exhausted. The best option in such scenario will be gamete donation. If you want to try with your own eggs, we can try newer experimental technologies such as ovarian rejuvenations with the PRP, that is platelet-rich plasma. But these are totally experimental, and whether it will work or will not work in your case cannot be predicted beforehand. You can take an attempt with a frozen or cold PRP. That's the best option for you. But still, you must understand it's a very experimental technology with a very limited experience with all over the world.
Right. Just a reminder to all the viewers, if you send these questions, do give us a few details like your age, etc. Plus the question, and if any medical conditions that you have, Dr. Goenka will be able to answer the questions better.
Yes,
have
definitely.
a little more data. Now, Dr. Goenka, you said something called gamete donation. What is gamete donation?
For just now, we heard about this previous patient where AMH is very less. So basically, we know that AMH is an indicator of the egg quality. And egg quality depends on so many factors, and most important factor is age, right? And unfortunately, age cannot be decreased. No surgery can decrease your age or my age. No surgery can, or no medication can decrease. We have appendix. Suppose I suffer from the appendicitis. I will go for the surgery. I will remove my appendix and I'm cured. If I have malaria, I will take quinine and malaria is gone. But can I decrease my age? No, it cannot be decreased. So aging is a natural process. It's not a disease. So someone who got married at the age of 40 or 41 or 45, in that case, obviously, egg will not be very good. But if they want a pregnancy, yes, gamete donation or gamete adoption is a very, very viable option. We can take egg from someone else and fertilize with her husband's sperm and put into her uterus. Baby will grow into her uterus, patient's uterus. It will be husband's sperm. Only the egg will be from someone else. That's a oocyte donation. That is egg donation. And there are other conditions where husband may be azoospermic. Azoospermic means no sperm at all. And there are conditions where there are no sperm in the ejaculate as well as no sperm even in the testes. For them, the best option is again for the sperm donation. Sperm can be taken from another person, fertilized with the wife's sperm, and we can attempt pregnancy. It's a very, very viable and noble option for the patients who doesn't have proper eggs or sperm.
All right. We have another question from a Facebook user. I'm 30 years old. It's been 8 years since our marriage. I've been unable to conceive. In 2014, the doctor mentioned tube blockage. In 2018, I got laparoscopy surgery done, but I'm still unable to conceive. The doctor mentioned that both my tubes are blocked. The AMH level is 2.39. Is IVF the right treatment for my condition?
Yes, definitely. Without any hesitation, IVF is the best treatment for you. Please go ahead with the IVF. What was the age of the patient?
30 years. 30 years.
Please go ahead as soon as possible. In your area, go and look for a good IVF clinic and go for the IVF as soon as possible. This is the right age to go for IVF.
Perhaps, the question is coming because she's still 30. And, at 30, many doctors would say you can try to conceive on your own. But because her tubes are blocked, does she really have any chance, or does she have a good chance to conceive on her own?
Yes, with the tube blocks, no, definitely not. We can attempt to open your tubes, but what type of blockage is there, what is the location, all depends on that. Most of the tubes which are blocked because of some infections are usually damaged. If you have already undergone laparoscopy surgery, don't waste your time. Go for IVF. This is the right time to go for IVF.
All right. Another question that we have received is, how many times should one try IUI or other treatments before IVF?
If you are planning to go for IUI, most of the pregnancies in IUI occur in first 3 cycles. Technically, we can try IUI up to 12 cycles, but we have seen all around the world, 80% of the pregnancies which has to occur through IUI occurs within the first 3 cycles. If you are not conceiving in first 3 cycles, please review your case with your doctor. If the doctor persists for another 3 cycles, well and good, or else go ahead with the next treatment.
All right, which is IVF, right?
And next treatment is IVF or laparoscopy. It can be anything.
Okay. Dr. Goenka, initially you had told us that there were 3 E's which were responsible for failed IVF cycles.
Right.
And the last E that we didn't discuss was environment. How does environment impact the success of IVF?
When I am talking about environment, I don't mean the outside storm which is going on here in Guwahati. I mean to say how is the prolactin level in the patient. There's hormones within the body. Whether immunologically patient is fit, there is no immunological problem. Whether all the hormones are checked and patient is not suffering from any hormonal imbalance. Thyroid hormone, which is a very common condition, hypothyroidism is a common condition. Whether the patient's thyroid levels are normal. When we are planning for IVF, we prefer TSH level, thyroid level should be less than 2.5. In a normal female who is not trying for pregnancy, thyroid levels, TSH levels up to 5 is normal. But if the patient is trying to conceive, going for IVF, then TSH level should be less than 2.5. There is a slightly change in the normal levels when we are trying for IVF. Prolactin levels again secreted from the brain, important hormone, very, very important hormone. That also decreases our chances of pregnancy if it is not under control. Another important aspect is stress. So if the patient is very, very stressed, the cortisol hormones increases almost double. That decreases our chances of pregnancy. So good psychological counseling, good relaxation techniques are very, very important when the patient is going for IVF. So these are the smaller things, but very, very important things which affects our chances of pregnancy. I have seen patients after IVF, they are so stressed, they don't move around, total bed rest for almost 10 days till the time they get the result. Even taking bath, daily day-to-day routines, everything they do on the bed, and so much of stress is there, and ultimately it doesn't help. It somehow decreases our chances of pregnancy. So these smaller things of the environment do make a difference, does make a difference.
So I just wanted to understand, you said that the hormones should be in tune with each other and at a level that works in our body. How critical is the insulin hormone in this? Does it impact your sex hormones at all, prolactin or FSH or other hormones? You also spoke about cortisol. On itself, an increased cortisol level, how does it impact you? Could you elaborate on what are the solutions? How can we get our hormones in line, including the thyroid?
Okay, there are few hormones which we measure just before IVF in all our cases, such as prolactin and thyroid, that is TSH, must be measured in all the cases before we start preparing for IVF. And there are hormones such as insulin or cortisol, which usually we don't measure because a lot of variations are there, day-to-day variations, diurnal variations. In the morning, their levels will be different. In the evening, levels will be different. So usually we don't measure for the insulin or cortisol. But if the patient is suppose having a problem of PCOS, polycystic ovarian syndrome, so obviously in these cases, insulin level will be altered. Patient is very much stressed, obviously cortisol levels will be higher. So there are hormones which we measure, and there are circumstances, and there are certain other disorders which tells us about the insulin or cortisols. So clinically, some things we measure, and in the laboratory, some things we measure. So both
How do you treat? How do you treat if something is in imbalance?
Okay. Thyroid and prolactin is pretty straightforward to treat. We give them medication for the thyroid, and simultaneously if the prolactin levels are high, again we give medication for both the things. For the cortisol level to bring under control, first line of treatment is always psychological counseling. Counseling is a very, very important aspect for stress level. So it is a must for every IVF patient to see psychological counselor before undergoing IVF. If required, multiple sittings with the counselor, that really helps. Talk to the patient, especially the successful patients, which can give you good stories. Talk to those patients who can give you good stories. So those things are important. Plus, we can give you medication if the cortisol levels are really high. We feel then we do give medication for these cortisol levels also. And coming to the insulin, if the patient is diagnosed to have polycystic ovarian syndrome is a problem which can be controlled with the medication but cannot be cured. You must remember that. So it is something like diabetes which can be controlled but cannot be cured. Similarly, polycystic ovary can be controlled, cannot be cured. So we give medication, something like metformin and other medications are there, which can be given to the patient to control these problems.
All right. Dr. Goenka, thank you so much for patiently explaining to us why IVFs do not work out at times, what could be the reasons and what could be the solutions. And thank you so much for answering all the questions that you've taken up from the audience as well.
Thank you, Anisha, for all the questions and all the time.
So that was Dr. Goenka answering your questions on fertility and IVF treatment during COVID-19. Now, if you have more questions, you can send them to us through WhatsApp. You just have to press on the WhatsApp button on our page and type in your questions. We'll include them in our next show. Don't forget to follow us and stay updated on all that concerns your health and well-being. This program was supported by Bharat Serums and Vaccines under its Public Awareness Initiative. We'll be back with another show on women's health very soon. Till then, take care, stay at home. Goodbye and see you soon.
Thank you. Good day.